Every year, thousands of people become sick with symptoms of cough, runny nose, and body aches. Oftentimes it's blamed on the flu, but it could be a case of the common cold. Our guest today is Dr. Nishant Shah, family doctor at our health centers, and he says there's a few key differences between the two illnesses. Dr. Shah, can you tell us how can our viewers know the difference between cold and flu?
This is a question I get all the time in clinic. Telling the difference between the cold and flu, there's some good principles to remember. First of all, the flu is a much more severe illness than we think about for the cold. The cold can be annoying, it can have a few symptoms, but usually you can work your way through it. With the flu, it usually comes on suddenly, usually within 24 to 48 hours. Fevers are a hallmark of the flu. Oftentimes you'll have a fever over 100 degrees, and it'll persist for a few days. In addition, the flu is oftentimes associated with muscle aches and body aches. People feel like they've been hit by a ton of bricks. It's usually the kind of thing where you're stuck in bed for the whole day and you just don't feel like getting out of bed. Fatigue is really common with the flu. People are resting a lot and don't find the energy to really get out and go on with their day. Where with the cold, people just find it annoying and can kind of move along with whatever they have to do. In addition, when we think about the flu, we also think about a disease that's more severe for people with underlying illnesses. So if you have lung disease, heart disease, or you're a young infant, the flu can be a lot more severe and you may need to seek emergency care.
Wow, sounds miserable. What can our viewers do to prevent the flu?
So one of the things that we think about is prevention for the flu is the flu vaccine. It's very effective. And we find that the flu vaccine can shorten the length of the flu. It can make the symptoms less severe, and it can make it less likely for you to pass on the flu to loved ones living in your home who might be vulnerable to the illness. On the other hand, just basic prevention measures like washing your hands, using an alcohol-based sanitizer, and covering your mouth when you cough are effective ways to prevent transmission.
Great. Thank you for that information. And thank you for watching Contra Costa Health Services, Your Health.